Most often, parents already know that their child has autism. They're just waiting for an expert to sit down with them and formally diagnose it. There are times where a parent doesn't know that's going on and comes into the appointment unaware of what it's called.
Now we just have one diagnosis called Autism Spectrum Disorder. Previously, it was broken up into succinct categories, and the categories were to help people understand different levels and different functioning levels of kids and persons with autism. Now it's all one disorder, and then we talk about different severity levels and functioning levels.
Autism is sometimes the A word that you don't want to hear it because you think it's going to be terrible, but autism is a spectrum, and there are children that have just a little bit of autism and who are in the mild range.
So a low-functioning person on the spectrum would have intense behaviors that are impeding their ability to be independent in their life, little to no communication skills, unable to interact with other people and their environment without additional supports. Then you're going to have the higher functioning level spectrum. So in the past it used to be called Asperger's disorder. People who have more of the stereotypic behaviors, repetitive interests, but their communication skills are there. They can communicate with other people, they can interact with others, but they still have some challenges and some barriers in those areas.
So difficulty with socializing with other kids, repetitive behaviors, such as toe walking, rocking, spinning. Those are the classic signs. The kids who are classically autism, you can almost diagnose right in the waiting room as soon as you greet them. They're fairly obvious, and pediatricians are generally good at identifying those.
If they're a young child, some of the things that you want to look for are a lack of eye contact, lack of being able to engage in pretend play. So for example, if you have a toddler and they are not interacting with baby dolls, they're not really using them to try to play, pretend to rock them or put them to bed. Another one would be social interaction. So oftentimes they prefer to be alone as opposed to be with other people. They don't start interacting with other kids. We call that parallel play, moving to more of an interactive play. They prefer to just continue to stay solitary.
Many kids with autism spectrum disorder have these heightened sensitivities to things tactile, things auditory, things olfactory and thermal. And as a result of that, they often recoil from situations and develop an intolerance for being in certain places and in certain environments. And the reason many of these kids have food-related issues is because of sensitivities that they have from an oral standpoint. They can't tolerate various textures in their mouth. They can't tolerate the smell of food or even the taste of food, for example. So those would all be some early indicators.
I think parents are afraid of the label of autism sometimes, and afraid that this is going to change the course of their child's life. And really, I've had no one come back and say they wish they hadn't labeled their child autism, because in beginning to accept a diagnosis of autism starts the therapy for it. So it really opens up their world. It doesn't close it down.